So I wanted to give everybody a really quick introduction to our Kavo OP3D Pro CBCT machine. Many of you are either getting into the CBCT realm or considering adding one to your office. So I wanted to kind of walk you through my experience and some of the general basics about this machine. You'll notice we have the OP3D Pro, which gives us some additional features from the regular OP3D. This is our sensor. This is the expensive piece of the puzzle. Well, it's all expensive. Of course, the touchpad, and then we added the cephalometric attachment as well. I'm going to just select a test patient. So that I can manipulate the machine. So as you can see the screen here, you can see that, there are basically three different options. We have conventional panoramic, we have 3D, and cephalometric. Now of course to use cephalometric we have to move the sensor over here, but for panoramic and 3D the sensor will stay here. So let me just demonstrate the positioning for panoramic. So generally you set the patient up here like you would on a conventional panoramic machine. Before having the patient enter, we want to make sure that we position the collector and the cone and the sensor in the right position, again, before the patient moves into the machine. Otherwise things will move around quite a bit, and that can be kind of awkward for the patient in the machine doing this. Fairly simple with the lines, you know, the lines that everyone's familiar with the panoramic. We'll have them either use the chin rest or a conventional bite stick. You can see the lines here that are active. So that's the panoramic. Pretty straightforward. Really good quality images here. When we go to the 3D, now we have a whole bunch of different choices. So with 3D, our machine has 4 different sizes of volumetric sizes that we can expose. There's the real small, which is the 5x5, so it's a little 5mm by 5mm cylinder that we can capture. And it's really nice because you can direct exactly where you want the machine to expose. And then we have an ultra high resolution mode on the smaller volumetric level. It's the only option, the smaller volume is the only option that allows us to have that high resolution image. Of course there's a 6x8, you know, if you just want to get the teeth, or the 8x8. Most people will fit in just fine into an 8x8 or a 6x8. A 6x8 I'd use for a single arch, 8x8 for both arches, just for the teeth themselves. And then, of course, we normally use the 8x15 because it gives us all the soft tissue. We can see into the airway, and tends to be the most frequently used volume in my practice. We normally, volume-wise, choice-wise, we normally use the large one or the smallest one on endodiagnosis. Like I mentioned before, once you get the machine, the option selected, then you have to position the machine before you put the patient in there. This is a common mistake that we see in our office. Is the assistant will select the patient, click on the option, put the patient in the machine, and then where are my lights? They can't see the positioning lights, and so then they'll hit the positioning button. And if you watch, this chin rest goes up and down, and so we have patients sitting here doing this while the machine is repositioning. But once it's positioned, then the lights pop on. And so you can see, I'm not sure if you can see it from that angle, but we've got 2 lights roughly here. And this is the volume. This is the area centered around where we've selected that will be captured. So rather than a panoramic where we're aiming one light up here, the CBCT, we have to position the area of interest within these 2 lines. So it's a little different mindset other than a panoramic. But like here we have a volumetric choice, we also have a quality choice. There's a scout scan, which is virtually no radiation. It's a very minimal radiation that gives us a ghost image so we can reposition the patient if we need to. And then if we go to low resolution, this is a really rough resolution if you're using it just for surgical, like for wisdom teeth planning. Low radiation. Standard radiation, or standard resolution, I'm sorry, not radiation resolution, but those two correlate. Standard resolution is a good image, but not really as clear as I like. So normally we go to high resolution for almost every one. And you can see the amount of radiation that's being calculated here. Anyway, once you've selected this option and you have all of these parameters set up, and there's a lot more detail, you know, on the website and other areas that you can glean that will give you feedback here, then you go and expose the patient. Now, we normally have our patients wearing the lead vest, the one without the collar will get in the way, and making sure when they're positioned in the machine that they're standing straight and tall before they walk in there. If the machine is already positioned, the patient will actually want to go in and accommodate the machine. So you have to position that machine where the patient is. So have them stand straight, nice and tall here, bring them in so that their chin matches right here. All these things are adjustable, up and down and forward and backward, so that we can accommodate the patient. But this machine has two adjustments, not only the height of the machine, but also the height of the chin rest. And the height of the chin rest is really where you fine-tune the positioning of the patient, or the positioning of the area of interest within the machine, to make sure that we're capturing what we want. We find normally when we're exposing those images that we want the line across the chin, not below the chin, because I don't really need to see this really thick, dense mandible. I want to see the teeth, and I want to see into the sinuses, and if I can, I want to see the TMJ, which we can see with this field of view, the 8x15. So that it usually means the patient's chin is up a little bit. Rather than down, I put their chin up, which moves the TMJ downward just a smidge, and that allows us to see this nice image right through with all the teeth. I don't put any cotton in between the teeth. I don't put any cotton in the mouth. I just have the patient bite down, swallow, hold the tongue to the roof of your mouth. That gives us a really clear image. I don't see the need to put cotton in there. Some docs like to do that. Some different machines recommend that. For me, I just don't feel the need to do that. But yeah, so this machine is really great. We take generally speaking, we'll take a high resolution full scan. It's about 70 microsieverts for every new patient. And we'll take a set of bite wings, anterior PAs, and a full set of photos on all our new patients. So usually I'm taking a full scan in place of either a Panoramic or an FMX. And that allows us to get a really high resolution 3D image of every patient that comes in the office. And it's amazing how much we see now that we couldn't see before. So that's a brief introduction to the Kavo OP3D Pro. Please don't hesitate to message me or let me know if there's any other questions I can answer for you.